Second reason why this could be a very unpleasant experience is I'm going to help you understand the different parts of Medicare, how to choose the right plan for you. If your income's not substantially low or substantially high, you would be paying $144.60 per month for your Medicare Part B plan. Hello, my name is Scott Nelson. I was recently reading a survey done of people over 65, and they were asked to rank unpleasant experiences that they dreaded. Number one on the list, colonoscopy. A very close second was shopping for Medicare. Now let's boil down to the reasons why this happens. First of all, it's extremely difficult to research. I challenge you to go on any search engine, plug in your zip code and ask for a Medicare quote. You're gonna go down this rabbit hole where they're gonna start asking you questions where you're not sure if it's necessary to tell them or not. But in order to get that quote, you're gonna have to give them your cell phone number and your email address. And if you dare press enter, you're going to be overrun with phone calls, emails, and text messages for not just the next 30 minutes, but days, weeks, and even years going forward. The people that are going to contact you are going to be salespeople who are going to try and fit a square peg into a circle hole. No matter what your situation is, you're skeptical whether or not what they're offering you is really in your best interest. Second reason why this could be a very unpleasant experience is their terminology is not something that comes innate to you. So all these Medicare terms can be confusing, and you might end up just throwing your arms up saying, I don't know what to do, I don't know who to trust, I don't know where to go, and you might end up just asking your neighbor or relative what plan they have and choosing it, and then being upset because it's not the right plan for you. What I'm going to do for you is I'm going to help you understand the different parts of Medicare, understand their terminology, help you determine how to choose a plan, what's right for you, your personal situation, and maybe at the end give you some tools to allow you to research this stuff without felt like you're being sold to. So why Thrive Medicare Strategies? So my background is as a financial planner. And when I first started the business as a financial planner, there was no such thing as Medicare prescription drug plan. So a couple years into my business, they made a rule that every single person on Medicare has to sign up for a prescription drug plan. And if you didn't, you received a penalty. So this was a hot topic that year. So my phone rang from one client asking me, which of these plans should I pick? And I didn't know what to tell them. And I was honest and I said, that's not my expertise. Second day, another client called me and I said, hey, let me see if I can find this out for you. And I walked around the office and talked to 30 other financial planners. And not one of them knew which direction to go. So the next day, a third person called me and I said, you know what? Why don't I just try to figure this out? How tough could it be? So what I had to do is I had to find out that there were 14 companies in my state who offered Medicare prescription drug plans, and each of the companies offered multiple plans. So I had to call up and spend 15 minutes on the phone with each company explaining to them, I do not want a salesperson to come to my house. I just want you to mail me a kit so I can take a look at the plan. All 14 of them sent me in. So you should have seen my office back then. I had stacks and stacks of paperwork, and it took me 2 weeks to go through them all. I found out two things. Number one, it's a whole lot more complicated than I ever get credit for. Number two, there wasn't one right plan for everybody. Of my 6 clients of Medicare age, all 6 of them ended up with different plans. So that year, my clients went back to their daily lives, playing golf, cards, going on their boats, seeing family members, and invariably the topic of Medicare came up. I received more referrals on a $15 prescription drug plan than I did on the stock market having a gangbusters year. So I gladly welcomed these referrals to my office and helped them choose the right plan for themselves. So the first year I did 6, the second year I did another 25 of them. Once that season was over, I received a phone call from an insurance company saying, hey Scott, we never recruited you, we never trained you. Your client satisfaction scores are through the roof. Who are you? So I went to coffee with them and they actually asked me to become their lead presenter for their Medicare 101 in my local area. So I started doing Medicare 101 education events for people. And fast forward 10 years, I've done the same presentation over 100 times. And come 2015, other people in my office who weren't making this part of their business were starting to realize how big of an issue this was becoming. 10,000 people every single day are turning 65. And this is a hot topic in our industry because healthcare and retirement is something that we're all trying to budget the clients for. Now, financial advisors, our training is how to budget for this expense. And I saw a slide in a presentation some years ago that I was baffled by. The average couple would pay $285,000 in medical healthcare expenses in retirement. So none of the topics that we're trained on are how to reduce that cost or minimize it. It's always how to budget and pay for it. So that's why I founded Thrive Medicare Strategies, to help my colleagues help their clients. At the end of this presentation, we're going to have you be able to make a informed, educated, confident decision on what plan is right for you. So let's start with the basics. Medicare is split into 4 parts: Medicare A, B, C, and D. Over 59 million Americans are covered by Medicare, and Medicare is run by the Center for Medicare and Medicaid Services, also known as CMS. I'd like to kick it over to Angela at CMS to talk about Medicare eligibility.
I'm Angela James at the Centers for Medicare and Medicaid Services, and I'd like to tell you about Medicare enrollment periods. Some people get Medicare automatically, and that means they don't have to do anything to sign up for it. If you're already getting benefits from Social Security or the Railroad Retirement Board, you will automatically get Medicare Part A and Part B starting the first day of the month that you turn 65. If you're under 65 and disabled, you'll automatically get Part A and Part B after you get disability benefits from Social Security for 24 months. If you're automatically enrolled, you'll get your red, white, and blue Medicare card in the mail 3 months before your 65th birthday or the 25th month of disability benefits. Now, if you don't get Medicare automatically, there are certain times throughout the year that you can sign up. First, there's the initial enrollment period. You can sign up for Medicare during the 7-month period that begins 3 months before the month that you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. So for example, let's say that you turn 65 in May. Your initial enrollment period would run from February through August. If you enroll anytime in February, March, or April, your Medicare coverage will start on May 1st. If you enroll anytime in May, June, July, or August, your coverage will start on the first day of the following month. Now, if you don't sign up for Medicare during your initial enrollment period, and you aren't eligible for a special enrollment period, which I'll explain in a minute, you can sign up during the general enrollment period, and that's between January 1st through March 31st each year. Your coverage will start on July 1st of that year, and you may have to pay a higher Part A or Part B premium for late enrollment. Once your initial enrollment period ends, you may have the chance to enroll during a special enrollment period. In most cases, you get a special enrollment period if you didn't sign up for Medicare when you were first eligible because you were covered under a group health plan based on current employment. The current employment could be yours, or it could be from a spouse or a family member if you're disabled. A special enrollment period means that you can sign up for Medicare anytime you're still covered by the group health plan, or during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first. Usually, you don't pay a late enrollment penalty if you sign up during a special enrollment period. So here's another example. Let's say you retire on March 30th. To avoid a gap in coverage, you should enroll in Medicare in March, before your employer coverage or employment ends. If you don't, your special enrollment period would run from April through November. If you enroll during one of these months, your coverage will start on the first day of the following month.
Next, let's talk about some important dates to keep in mind. Angela already talked about your IEP, your initial enrollment period. That's the 7-month window surrounding your 65th birthday or when you first become eligible for Medicare. At that point, you're given guaranteed issue status for a Medicare supplement, Medicare Advantage prescription drug plan, and once that IEP is met, you're now on the same calendar as everybody else, where October 15th through December 7th each year, you're given an AEP, an annual election period. At that point, you can switch to Medicare Advantage plans, your drug plans, your supplements. You can make changes during that period. Now remember, during annual enrollment period, whatever selection you make becomes effective on January 1st, and it runs the next calendar year. Another thing to keep in mind is your open enrollment period that's January 1st each year. During that window, you're eligible to switch your Medicare Advantage plan from one to another. Almost think of it like a buyer's remorse, where if your plan doesn't have a doctor or a drug or something you want, you can make a switch from one Advantage plan to another during that period. Other than that, it would take a special enrollment period status to make a change. So throughout the year, if you move in or out of the plan service area, so if you move from one state to another, you have to switch plans. If you come off of group coverage, you retire, you're given a special enrollment period. Other things that would fit into this bucket would be if you are diagnosed with a qualifying chronic illness, if you qualify for a low-income subsidy or get extra help from the government. Other than that, you really are stuck in the plan you chose, so choose wisely. Let's talk about how to choose the right plan for you. We've established how you qualify for your A and your B. Let's talk about what they cover. So Medicare Part A covers your inpatient hospital. There's a deductible of $1,408 on Medicare Part A. Medicare Part B is your outpatient or your doctor office visits. The deductible on that is $198. In addition to the deductible, you have to pay 20% of the Medicare costs. So if Medicare pays $80, you pay $20. You notice what this doesn't include is your prescription drugs, and it also doesn't have an out-of-pocket maximum. So your expenses are not capped, okay? So there are some major gaps here. So to keep things constant, let's assume that you're right in the middle as far as income goes. So if your income is not substantially low or substantially high, you would be paying $144.60 per month for your Medicare Part B plan. So let's see what you add to those A and the B and compare them. Really, the only choice you need to make is deciding what you need to protect. And I tell people, insurance, you're supposed to protect what you can't afford to lose. And you have to decide how much of the risk you're willing to take and how much you want to transfer to an insurance company. And if you understand those two things, everything else will fall into place. So let's take a look at the only major choice I'm going to make you make. And if you tell me which philosophy you prefer, it makes my job simple. Original Medicare. If you add a supplement to it, the benefit to doing this way is if the doctor takes Medicare, your supplement is in network. You don't have to worry about looking up doctors and hospitals. So you can go to any doctor in the country that takes Medicare and have your supplement cover you. The plan I'm going to use for this comparison right now is Medicare Plan G, and I'll get into that later on in the presentation. So Medicare Supplement Plan G covers everything Medicare does. It does not cover the Part B deductible of $198. Above and beyond that, all your other Medicare expenses are covered at 100%. If you have Medicare Supplement Plan G, and the national average for the Plan G, so the positive is no networks and very low out-of-pocket expenses if you have a bad medical year. The negative is you have to pay an associated premium for this. The national average Plan G is $180 per month per person. Now, in addition to that, you also have to add a prescription drug plan. And we're going to get into a whole section on prescription drugs, how they work, but for this purpose, understand that the national average for that is $35, and they range anywhere from $15 up to $100, depending on the drugs you take. On this side of the page, you have to budget $215 per month in addition to what you paid for Medicare Part B. So let's talk about the other side. Medicare Part C plans are underwritten by an insurance company, and they typically fall into one of two categories, an HMO or a PPO. And there's a whole section on Medicare Advantage, but we'll get into those as well. They bundle all your A and your B services at minimal A and B cover, and also most of them include your prescription drug plan, and a lot of them include extra benefits that aren't typically covered under Medicare. So the positives of these are low premiums, typically, much lower than the supplement side, and also the extra benefits such as dental, hearing, vision, over-the-counter supplies, and the list goes on. The negative, though, is networks. An HMO, you're required to go to network doctor. A PPO, your preferred provider organization. So you pay lower costs if you go to network provider and higher if you go to network. The other negative is co-pays. You pay as you go. So let's take a look and compare the two sides. On the supplement side, you start the year at $215 per month times 12 months is roughly $2,500 in premiums. On the Advantage side, you start the year at 0. If you start adding up your copays, your 10s, your 15s, your 20s, your 50s, your 200s, you have to take a look at your typical year. How many times you see the doctor? What are my typical copays going to be? And also take a look at your worst year. What about your hospitalizations or your rehabs or your skilled nursing? Will your 0 approach the 2,500? Go past it. And if it does go past it, how much past it? You do have the peace of mind that on the Advantage side, you do have an out-of-pocket maximum. So if you go well past the 2,500, your expenses are capped. So just to summarize the two differences: supplements, no networks, high premiums, low out-of-pocket costs for if you have a catastrophic year. Advantage side, you have to deal with networks, but you do have some extra benefits. So say if you need a hearing aid, it might be covered for a copay. Positive is you start the year at 0, you take control of your medical costs, so you pay as you go. And if you have a relatively healthy year, you might pay very little in your copays and save yourself a couple $1,000s while adding some extra benefits. So if you understand this concept, you have the education to understand which plan you prefer, which philosophy you prefer, and it makes our job easy. You tell us, I like the Advantage side. It'll help us shop for you a Advantage plan that will cover your doctors, cover your prescription drugs, keep everything in network, give the extra benefits you prefer. Or if you say, I want to have the peace of mind to be able to go to any doctor anywhere and not care what it costs, what tests are done, and I want to be able to walk out of there with a bill for 0, then the supplement side is for you. With that in mind, let's move on to look much more detail about the two sides. Of the 59 million Americans currently on Medicare, 22 million of them chose to go with the Medicare Advantage type plans, and that grew by 1.6 million just last year alone. So in order to enroll in a Medicare Advantage plan, you first must be eligible and enrolled in Medicare A and B, and continue to pay your Medicare Part B premiums. So if you go the Medicare Advantage route, you will now be insured by a private insurer. And this private insurer has to at minimum offer everything that Medicare A and B did. But they can also offer some very nice extra benefits as well. So there's 4 types of Medicare Advantage plans. First one is an HMO. That stands for Health Maintenance Organization. So on an HMO, you're given a book of network contracted doctors. You have to go to a doctor or hospital that's in that network. If you go outside of that network, you'll be responsible for the bill. A more flexible type of plan is a PPO, which means Preferred Provider Organization. You can still go to a network doctor and get some great reductions in prices, but if you go outside of that network, you still have coverage, you just have to pay a higher co-insurance percentage or a higher copay. Another type of plan, a little bit less common, is a private fee-for-service plan. These plans, you still do have to go to a doctor that accepts the terms and conditions of the plan. And the 4th type of plan is a special needs plan, which includes a chronic illness type plan for people with diabetes, heart conditions. These plans are tailored to your ailment. So the insurance company, through experience, knows what types of things they can do to keep that type of population healthy, and they built plans specifically for them. Another type of special needs plan would be a dual eligible plan for people on Medicare and Medicaid. And the last type of special needs plan are for people who live in an institution such as a nursing home or skilled nursing facility. So let's get into the extra benefits. First extra benefit is a prescription drug plan embedded into it. Now this is optional. There are some Medicare Advantage plans without that for people with credible coverage such as veterans or from another source. More extra benefits include dental, vision, hearing aids, over-the-counter supplies, 24-hour nurse hotlines, teledoc visits, a lot of extra benefits such as gym memberships, meals, following surgeries, and even some include transportation to and from doctor's office visits. So when you're shopping for these plans, one of the most obvious key factors to shop for them is the list of your doctors. Especially with an HMO, you want to make sure all the doctors are important to you take the plan. Now, if you notice a couple of doctors aren't contracted with it, a PPO plan might make sense, but you do have to be aware that you will have to pay a little bit extra to go see those doctors. Another factor is your list of your prescription drugs. And all these plans also have different values on the extra benefits. So if you know you need a hearing aid, you might want to shop for a plan with a great hearing benefit. Or if you say, I need some dental work done, focus on the dental type plans. I invite you to visit our website, provide us a list of your doctors, and we can help shop you for the different plans. And also, let us know what's important to you. We can help do that legwork for you and boil this down and make your work easy. So let's assume you decide to go the Medicare Supplement route over the Medicare Advantage route. These plans are also called Medigap, and they were intended to cover the gaps in original Medicare. So your Part A deductible, your Part B deductible, your 20% co-insurance, that's what typically was covered under Medicare Supplement plans. Now, we've talked about Medicare A, B, C, and D. So what do you think they named the supplement plans? Letters, of course, right? I mean, why not try and confuse you more with different letters? I mean, they could have named them numbers, colors. I would have preferred if they named them birds. I mean, I would have loved to go home and tell my 5-year-old that I set 5 people up with a peregrine falcon plan today. But not to get us too much off topic. 2020 saw some pretty substantial changes in Medicare supplements. The most popular plan historically has been Plan F. They're phasing out Plan C and Plan F for newly eligible Medicare people. So if you love your Plan F, you don't have to get rid of it. Just understand that as your neighbor or relative is turning 65, they might not be able to get the same F plan as you. A very similar plan is a Plan G, which covers all the same things as F, but it does not include that $198 Part B deductible. So one nice thing they did to help us shop for these plans is they made, all but 3 states made standardized plans, where you have a menu of 10 different plans, well 10, and it's now down to 8 for newly eligible people, where you have a menu of what they cover, and you can decide what to take away and what to add to, reduce the premiums. So, like I said, all but 3 states have these plans. So when you're shopping for the plans, it makes it a lot easier. So you know that one company with a Plan G covers the exact same thing as another company with a Plan G. When you're shopping, you really have to take a look at how stable the companies are. Take a look at history of rate changes. You don't want to pick a company that is the least expensive that is just going to pop the rate up the following year. You also want to take a look at the customer service reputation. And another factor is, obviously, if it's covered the same type of coverage, price. It's amazing how much these prices can differ from plan to plan. I've seen them as much as $200 to $300 difference for the same exact insurance. So it behooves you to shop for these plans. And I would warn you, do not put your zip code, your date of birth, and your phone number online. I mentioned that earlier, but really trying to find a good way to shop for it. My company, we have some tools where we can shop all the different plans in the areas and get you a rate. And you'll be getting emails and phone calls from one person if you want. Feel free to email us or visit our website to give us your zip code or your date of birth, and we can let you know what the supplement rates are in your area. How does Medicare Part D work? Let's take a look. So these plans are offered through private insurers, whether it's in the form of a standalone prescription drug Part D plan or embedded into a Medicare Advantage plan. Now, even though they're offered by individual insurers, they do have to follow the same structure. Now, one of the things when we talk about the structure is a lot of people look for plans that do not have a donut hole. Let me talk about the donut hole a little bit. This is the coverage gap. And really only 1 in 9 people fit that, fall into the coverage gap each year. And it used to be, when these plans first started coming out, a much, much larger problem. There was actually a real hole in the plans where if you reached a certain level, you had no coverage and you had to pay for the whole prescription drugs by yourself. Each year that coverage gap got more and more narrow, and your cost share during that gap has decreased. And we'll get into what the cost of that is in the next slide. So like I said, each of these plans have a similar structure where there's 4 stages to it. First stage is your deductible period. Now, not all plans have deductibles. Some plans have deductibles on certain tier drugs, but all of them are going to have a deductible period, and whether the deductible is waived or not, that's specific to the plan. Once you reach your deductible where you paid the whole cost of drugs, you're now in your initial coverage stage. This is where you look up your formularies and the tiers and you find out what your co-pays are for this next stage. Now, while you're in this stage, you're paying your co-pays. The whole time, your insurance company and Medicare is adding up not what you paid, but what the total cost of the drugs were. So you're in the stage until your total cost of the drugs reach $4,040. So you add what you paid plus what the insurance company paid to figure out how long you're in the stage. Once you're out of the stage, you are now in that donut hole, where, like I said, in the past, you had to pay the whole amount. It's been reduced over the past several years down to 25% is your share of the name brand and the generic drugs. And the other 75% is actually paid by the drug manufacturer. The important distinction is you get into the donut hole by what the total cost of drugs were. You get out of the donut hole by what your out-of-pocket costs were. Fortunately, they add what the drug manufacturer paid to the out-of-pocket costs. So in order to get in, it's $4,400 of your total drug costs. To get out, it's $6,350 of the out-of-pocket costs. And once you're out of this stage, you are now entered the catastrophic phase, where you pay little to nothing for your prescription drugs. It's capped at 5% of the cost of the drug. Now that we understand the general structure of a prescription drug plan, let's take a look at how to analyze each insurance company's offerings. First thing you need to do is make sure that the pharmacy that you want to go to is in the pharmacy network. Additionally, a lot of plans now are starting to offer preferred pharmacies where you can get extra discounts if you go to certain pharmacies. And you also will most likely have a mail-in order option where you get the preferred pharmacy reductions if you go that route. Next thing you want to take a look at is each company has a formulary for its specific plans. So a formulary is the list of the drugs, and just because something is tier 1 on one plan doesn't mean it's tier 1 on all the plans. It might be tier 2 on another company or not even covered on a third company. So each plan you have to take a look at that. And then each company's individual plans might have different formularies or different tiers. So you have to make sure you're careful about which plan you're analyzing. And now that you've taken a look at the formulary, once you find your drug, you might notice some different numbers or symbols next to the drug name. First thing is you'll see the T1, 2, 3, 4, 5. That'll tell you which tier the drug is on, and then you take a look back at the summary of benefits and you say, if it's a tier 2 drug, it's going to be this much cost. In addition to that, you might see the letters ST. ST stands for step therapy, and that simply means there may be a lower cost option that could save you and the insurance company some money on that prescription drug. Sometimes you might say, hey, I tried that drug a few years back and it didn't work for me, or it had a bad reaction with my other medications. So that's why a step therapy is. They're making a suggestion that you try the other drug. And if there's a specific reason why you need to continue to take that specific drug, that's something you would deal with your doctor, and you could ask for an exception. QL is quantity limits. There might be some drugs that may be too dangerous, perhaps, to give a large quantity at one time. So, they might limit you to a 14 or 30-day supply on certain prescriptions. The next set of letters you might notice are PA. That means you need prior authorization to continue to take that drug. There may be new prescriptions out there that have been proven to be more effective or specifically to treat your ailment. And the insurance company might want a more detailed explanation. So it's a more stringent form of step therapy. And again, you can ask your doctor to help you with this exception process. So what the insurance company is going to require is you go to your doctor and have them explain why they recommended this specific drug over the alternative. And if you do that in writing, the insurance company will typically get you an answer within 72 hours. Next, I would like to kick it over to Angela again for a brief discussion on how the Medicare Part D penalty works.
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services. I've got some important information to share with you about Medicare and you. Medicare offers prescription drug coverage, known as Medicare Part D, for an additional charge to everyone with Medicare. If you don't use a lot of prescription drugs now, you may still want to think about joining a Medicare drug plan to help protect against higher costs in the future. And if you don't join a Medicare drug plan when you're first eligible for Medicare, and you don't have creditable prescription drug coverage, you may have to pay a late enrollment penalty if you join later. You don't have to pay a penalty if you have and keep creditable prescription drug coverage, or if you get extra help, which is a program from Medicare that helps people with limited income and resources pay for their prescriptions. Now, you're probably wondering what we mean by creditable prescription drug coverage. Simply put, creditable prescription drug coverage is drug coverage that's expected to pay on average at least as much as Medicare's standard prescription drug coverage. Examples of creditable prescription drug coverage are drug coverage from a current or former employer or union, or TRICARE, the Indian Health Service, or the Department of Veterans Affairs. Now, if you have creditable prescription drug coverage when you first become eligible for Medicare, generally you can keep it without paying the late enrollment penalty if you sign up for Part D later. The late enrollment penalty is added to your monthly Medicare Part D premium, and the amount depends on how long you went without creditable prescription drug coverage. Here's how it's calculated. We multiply 1% of something called the National Base Beneficiary Premium times the number of full uncovered months that you were eligible but didn't join a Medicare prescription drug plan and that you didn't have creditable prescription drug coverage. That final amount then is rounded to the nearest 10 cents and it's added to your monthly premium. You don't want to pay the penalty? There are 3 ways to avoid it. 1. Join a Medicare prescription drug plan when you're first eligible. 2. Make sure you don't go 63 days or more in a row without a Medicare drug plan or other creditable coverage. And 3. Tell your plan about any drug coverage you had if they ask you about it. If your plan thinks that you went for some time without creditable drug coverage, you may have to pay a penalty.
Thank you, Angela, for that wonderful explanation. Shopping for Medicare prescription drug plans is the most complicated, but it doesn't have to be the most difficult part of shopping for a Medicare plan. There's an amazing tool available to us on Medicare.gov's website. You plug in your zip code, your preferred pharmacies, your prescription drugs specific to the dosage and quantity, what type of plan you're shopping for, and they're going to help us do all that research. First time through this might take you an hour or 2. Our team's done this hundreds of times, so I would invite you to visit my website. Sign up for a half-hour consultation, provide us your list of your prescription drugs. We'll generate that report for you, help show you all the plans available to you in your area, show you specifically what they will cost at some different pharmacies, knowing the plans, which ones have preferred ones and whatnot, and help you enroll in the one that will help save you the most money that has all your drugs covered. Save yourself a couple hours. Get rid of the frustration, get rid of the unknowns, and come join us. We're happy to help. I'd like to thank you so much for the valuable time you spent with us today. Hopefully by the end of this presentation, you feel educated, informed to make a decision you feel comfortable about. I'd like to share with you a few more resources. First one I mentioned a few times is Medicare.gov. There's several articles about the rules and regulations about Medicare, and also some nice tools to help you research some plans. Another way to take a look at the details about Medicare is the handbook they send us, the Medicare New Handbook each year. If you're curious about learning about low-income subsidies, there's a website called shiptalk.org. And if you want a place where a lot of this information is boiled down, speaking to you in layman's terms, visit my website. We're there to help you understand and guide you through this. Through our website, you can watch more educational videos, you can read some articles, some blog posts, and also you have an option to sign up for a free consultation with one of us at Thrive Medicare Strategies. So I do appreciate the time, and we're here to help, and please reach out if there's anything we can do for you. The opinions voiced in the material are for general information only and are not intended to provide specific advice or recommendations for any individual.